Hello, everyone. My name is Korkor. I'm the founder and the CEO of the AB Korkor Foundation for Mental Health. I'm welcoming you back to the third of the series of webinars that we have put together to address strategies for mental and emotional wellness during the COVID-19 and pandemic and beyond. Our first presentation was on May 27th by Dr. Bartholomew on exercise strategies that can change your mood and improve your health. We had a great response to this event. It was incredibly valuable information that helped all of us. The second presentation was by Dr. Lerman at the Medical College of Wisconsin, discussing strategies to avoid depression, anxiety, and addiction associated with this pandemic. Again, a very practical presentation, was very well received. And today we are honored and delighted to have Dr. Barbara Moser, who is part of the Prevent Suicide Greater Milwaukee Coalition. And she is a retired family practitioner. She has done incredible amount of work in the area of suicide prevention and education. Uh, and she will guide us today through this presentation, very valuable presentation that relates to the current impact of this pandemic on sense of isolation, the sense of loneliness, that also the sense of loss of job, loss of control, and as a result, one would be very despaired. And as you may all know, that was discussed by Dr. Lerman, that the incidence of suicide, for example, in Australia, recently turned out to be much higher than the number of deaths that were seen related to COVID-19. So we all anticipate that events of this nature will take place and will result as a result of this major pandemic. So a few housekeeping items. This presentation will be available for those who signed up. However, those who did not sign up will have to wait until the completion of the four presentations before they can access it on our social media on YouTube. To the right of your screen, there's a chat room area. But if you have any questions, please address them in the question and answer section at the bottom of your screen. Our staff will be addressing any concern that you might have technically. Otherwise, Dr. Moser, we welcome you to this presentation, and I thank you so much for willing to do this. And the stage is yours.
Okie doke. Well, thank you very much, Dr. Korkor. It's a pleasure to be here with all of you today. And I'm going to just upload my slides. And the one other thing I wanted to just mention is that my latest little endeavor in life is that I've also become a teacher of mindful self-compassion through the Center for Mindful Self-Compassion. And so toward the end of the presentation, I'm going to touch on that as well. So with that, I guess we can start the slides. So that's just me. And today I'd like to cover just a little bit about how our brain works. We'll talk about despair and suicide. So this sometimes can be a very difficult topic for folks. And so if that is the case for you, please take care of yourself and do what you need to do to be comfortable with this material today. Okay, be kind to yourself. We'll talk about a little bit about what we can do and a bit about self-compassion. Okay, so I wanted to just talk for a moment about our brain. And it amazes me that I got through many years of my professional life, including medical school, without some very just sort of practical knowledge that was at my fingertips about how our brains work. One is that, first of all, our brains have evolved over millions of years, and really only as Homo sapiens since about 100,000 years ago. And there's some debate when modern humans came into the scene, but a bit less than 100,000 years ago. So our recent history is really extremely short when you look at the long stretch of time here. Human beings are absolutely wired for connection. And it's this connection that really has made us so incredibly successful, our connection and our cooperation. We also have a negativity bias, and this has served us well when we were living in wilder circumstances, had to elude tigers and other predators. Our brain is constantly scanning for danger. But now in the modern world, we don't always need to be on alert, and yet we still are. Our brains are really like Velcro for the negative, and we say Teflon for the positive. And so we do tend to focus and ruminate on the negative, particularly as we're able to put ourselves into the past and the future. This really fuels this rumination. Human beings also love a sense of control. And so we really like to know what's going to be. We like things to be predictable. And our brains like to make order and sense and meaning out of what's going on in our lives. Now, the great news of the last couple of decades is that our brains can change up until the end of life. So we can actually change our brain habits. And this really comes into play with resilience, learning new skills like mindfulness and self-compassion, that when we practice these neurons start firing together in patterns that become habits. And so we can actually change our brains by what we focus on with our minds. And so this is really great news. It certainly has been great news for me because I'm almost 60 years old and I've been able to change some of my brain habits over the last 5 years, and I've really appreciated that. Okay, so very sadly right now we are living in this pandemic, and there are a number of factors which relate to how our brain functions that get really that fuel our negative thinking and despair. So we're isolated. We have decreased physical touch. People in our country, especially, there's already been just huge amounts of loneliness. And so this constant being alone and not being able to be with people and touch people is really impacting further this loneliness. And again, we're wired for connection. We don't do well when we're not connected. There's also been a number of stressors, financial, health, and family stress, which really focuses our thinking on the negative. Certainly the news comes into play here too. We're under a constant barrage of negative news. And most sadly is our loss. Our loss. Dr. Lehrman spoke of this very eloquently, and in terms of deaths, loss of good health, loss of jobs, loss of school opportunities, financial security. We may be facing foreclosures in the future. It's an amazing amount of loss that then really results in grief. And then, unfortunately, there are lots of us who use some negative coping strategies, alcohol being one, substance use, is just a big problem. And reportedly, alcohol sales are up right now, and certainly firearm sales are up for a variety of reasons. And this is certainly not a political statement, but firearms and just having a firearm in one's home increases the potential for violence and for suicide. So we'll talk a bit about despair, right? So despair is really hopelessness, no hope that things are going to get better. And for folks who are already on the edge of balanced life, this current situation can really push them into despair, particularly for people who are living with a mental health diagnosis, a substance use disorder diagnosis, people who are living in poverty, homelessness. Having this situation now, the pandemic on top of it, can just be a final straw that pushes us into despair. And sadly, people do die of despair. And this term has been coined recently, deaths of despair, which include deaths from suicide, alcohol, and drugs. And you can see how the rates since the year of about 2000 have been steadily increasing in all three realms, and particularly in drug overdose related deaths, which really started to pick up in 1990 and has continued. And this is really making that rate go way, way up and very quickly. And likely, and this is the theory, is that many synthetic opioids were developed in the 1990s and came on the market, and deaths from opioids overdose account for about 60 or 70% of current of drug overdose deaths. So that was a big factor there. But I really study suicide deaths and work in that realm, and so I'm going to focus on that. But you can see in 2018 in the US, we had 48,000 deaths from suicide, 58,000 or so deaths related to alcohol, excluding accidents, and overdoses about 67,000. So, and then you can see the data for Wisconsin, which is where I live and where we're at. So, and these deaths continue to go up in the U.S. In Wisconsin, the deaths were actually down a little bit in 2018 from 2017, but still very, very significant. And so this is a graph that shows how suicide rates have increased now in 2018, about 35% since 1999. Men die from suicide much more frequently than women, about 3.5 times the rate of women. This is for a variety of reasons, including the fact that men tend to use more lethal means for a suicide attempt, and most often firearms. Yeah. So suicide in the US is the 10th leading cause of death. And in young people from teenage years up until the age of 34, it's the second leading cause of death following accidental death. So these numbers are significant. And slightly more than 50% of suicide deaths in 2018 were due to firearms. Mental health diagnoses are a significant factor. We have often said that about 90% of persons who die from suicide have a diagnosable mental health issue. Although there has been some recent data when looking at violent deaths, to show that perhaps as many as 40 or 50% of persons who die from suicide did not have a diagnosed mental health disorder at the time. So, these deaths of despair don't always come in association with a mental health disorder. Okay. All right. When we talk about suicide, we're really talking about more than suicide deaths. Deaths are the tip of the iceberg. Many, many more people attempt, about 1.5 million persons, we think, in the US in 2018. It's approximate numbers because we don't know of all the attempts. And there are many survivors of suicide loss. And so, probably more than 50% of persons in the US are impacted by suicide. In young people, there are more attempts than deaths, but in our older population, it's about 4 attempts per 1 death. So, this is really disturbing. Okay, so I want to talk a little bit about risk and protective factors. So on the left here are the risk factors, and we can go through these. So isolation is huge, use of drugs and alcohol, social situations such as living in poverty, homelessness, mental illness, having a diagnosed mental illness, a history of trauma. And one other thing here is access to lethal means, access to a way to attempt suicide. And then often loss is the final straw that will plunge a person into this extreme hopelessness and despair that leads to them contemplating suicide. Loss could be loss of good health, loss of a job, loss of a loved one, death, being exposed to a suicide, having somebody in your life die from suicide. So many different losses that can then cause a person to really contemplate suicide. And so what gets in the way of that? Because obviously many more people contemplate suicide than actually attempt suicide. And so that brings us to these protective factors on the right-hand side of the slide, which are so, so, so important. They're what give us hope. So having a sense of hope is essential. It's really at the core of protective factors. And what gives us hope? Well, being connected to our community, having people that we feel we belong to them, having a strong sense of belonging is so important. Having access to treatment, to medication if needed, if we're living with a mental health disorder or a physical health diagnosis. Having some coping skills and resilience strategies are very important. And then sobriety, not overusing drugs and alcohol, is a real fundamental, foundation for protection. And so these factors kind of interact, and then there's sort of a balance, and if a person's distress and despair and great emotional pain exceeds their resources, their protective factors for dealing with that pain, they may contemplate an attempt and potentially die from suicide. So these are some of the warning signs for suicide. This comes from the National Suicide Prevention Lifeline. And I want to just note that I have given the webinar organizers a resource page that has some links on here to protective and risk factors, to these warning signs. So talking about wanting to die or kill oneself is a huge warning sign, And you might say, well, duh, but actually not, because a lot of times, this is a horrible thing to hear from somebody, particularly if they're really close to you. And so we sometimes, denial is very powerful for very good reasons. And so we may actually not act when we hear that somebody wants to die or kill themselves for often very reasonable and good reasons. So this is not a criticism, but we need to take it seriously when somebody expresses a wish to die. They may be looking for a way to kill themselves, like searching online for methods or purchasing a gun. They may talk about feeling hopeless and having no reason to live. They often talk about feeling trapped or being in unbearable pain. And this pain is just as real as any severe physical pain. It is felt just as severely. They may talk about being a burden to others, a big factor. This is, people would be just better off without me. They may show that they're increasing their use of drugs and alcohol. They may be anxious, agitated, behaving recklessly. Their sleep may be affected, sleeping too little or too much. They may withdraw or socially isolate themselves, not participate in activities that normally give them pleasure. They may show rage or talk about seeking revenge. They may have extreme mood swings. And they may even be giving away prized possessions, including pets, seeking care for their pets. So these are all really important warning signs that we need to take very seriously. So what do we do? This is, again, and there's a link to this on the resource page. These are the steps we can take to help people when they are thinking of suicide. So if we suspect somebody's thinking of suicide, the first thing we need to do is really ask them. And there's a myth that if we ask, could we actually plant the seed that they might actually kill themselves because we asked them? This has absolutely been shown in multiple research studies not to be the case. By asking, we actually decrease their chance of killing themselves because they finally feel heard. Somebody recognizes just how upset I am. And so we want to ask with great compassion. And when we can give this person our undivided attention, and then we want to ask very directly, are you thinking of killing yourself? Are you thinking of ending your life? Are you thinking of suicide? So asking very, very directly, because people who are thinking of suicide may not be thinking all that clearly. And so we really want to be very clear. And if, I'm a huge believer in following your gut. And if your gut is still telling you, well, I'm not sure if I believe this, we need to be very persistent. We need to circle back and ask the question again and be asking it in a different way. So actually, I want to go back to the previous slide. So then we also need to keep people safe, okay? So we need to ask, okay, do you know how you're thinking of killing yourself? And do you actually have access to pills, to a gun, Do you have that in your home already? Are you preparing to kill yourself? People make plans and make some preparation. And then asking them, do you have a plan? And are you actually planning to act on this plan? And so really finding out some of this information. And then we need to be there, okay? And right now this is tough because we can't sometimes physically be there, but we need to be present. We need to be there and stay connected with the person until we're really convinced that they're either okay or that we need to help and get them help. And that's the next step, helping them connect with help, that may be through their medical provider, their mental health provider. It might be calling the National Suicide Prevention Lifeline number, which is on this slide and will come up again in a future slide, or the text line. It may be that we need to help them create a safety plan. And there's an app called the My3 app, again, on the resource page, which helps create a safety plan virtually. So these things can help us virtually help people connect. And telehealth is huge right now, including for mental health appointments. That Dr. Lehrman spoke quite a bit about this. And so we can absolutely help people connect with mental health providers. And then we need to follow up. Following up really helps people feel cared for. And it's very important to follow up in a day and say, how are you doing? You know, oftentimes people are suicidal or thinking of suicide for very short periods of time, sometimes not. So we need to follow up and find out. Okay, and then we may need to inspire some hope in their lives and, you know, really think about what keeps you going every day. Who are you talking to? What's important to you in your life? What are you looking forward to? Really trying to see if there's some future thinking. That helps people connect with the future and keeps them alive. What has helped you cope with very tough times in the past? And then give them referral numbers and have these referral numbers yourself. You'll have these slides, so you can put these in your phone at a later time. And then there are some apps like the My3 app, which helps with the safety plan, and a friend asks, which basically takes you through a whole series of steps in how to help keep people safe. So these are good resources for these times where we can't be there in person. So, wow, this is a lot on suicide, and there are places to learn more, and you can take training as well. And I have some of those links as well on the resource page. But right now, I thought maybe we'd take a quick break. And I really would, because this is hard stuff, you know, and it may be making us feel more anxious. And so we have some amazing physiology that we live with. And one of those things is that when we can activate our parasympathetic nervous system, it really helps us to calm. And one way to do that we have with us all the time is our breath. If we can make our expiration, our breathing out, longer in duration than our inspiration, we activate our parasympathetic nervous system, and it helps give us a sense of calm. I'm a very anxious person. I use this breathing technique multiple times in my day, including at night when I can't sleep. And so I thought maybe right now we could pause and maybe just, if you can, take your eyes from the screen. You might close them or look downward. And just let's take a few breaths together where we're breathing in to the count of 4 and we're breathing out to the count of 6. So let's do that together, and I'll count for us. So in, 2, 3, 4, out, 2, 3, 4, 5, 6. In, 2, 3, 4, out, 2, 3, 4, 5, 6. In, 2, 3, 4, out, 2, 3, 4, 5, 6. And perhaps even noticing and staying with it a little bit. Do you feel any different? Do you feel a sense of calm and really taking that in? These are the moments when we rewire. This has been shown by work of Dr. Rick Hansen and others. When we can stay with that feeling and really absorb it and take it in, those are the times our brain can rewire. And so I invite you to try this breathing and making your expiration longer than your inspiration during these moments of stress and anxiety and difficulty. So we can go back to our slides now. Yeah, thank you. Okay, so what can we do? What is going to support my well-being right now? This is a really good question to keep asking yourself. So one thing, of course, is connection. And how do we connect? And, I'm not going to go over the myriads of ways that we've all discovered of how we can technologically connect, right? We know this. We've been figuring this out for the last couple of months. But I want to just talk for a couple of minutes about the quality of connection, because this is so essential. So perhaps when even a few moments before you're going to make that call, send the text. Maybe it's you that needs the connection, and maybe you're checking in on another person who needs the connection. And asking yourself, what do I need in this moment? And what does this other person need whom I care about? What do they need from me? Checking in and pausing is a great way to regroup, and it helps us to be present, to really be all there and not distracted when we make the call, Also, really coming from a place of compassion, of good listening, timing, having enough time, not calling when you have 1 minute before you have to jump on another call. And we express so much with our tone of voice, with the timing, how fast we're speaking, with our words. You can even see as I'm going over this, I'm slowing down, right? Because this is really important, how we speak about it. And really, we're talking about love for ourselves and love for our fellow human beings. We're all in this together right now. And I'm not talking about romantic love. I'm talking about this deep caring about another person, how they're doing, what's happening to them. This is the type of connection that really makes a difference. Another issue is that we're wearing masks a lot of time now in public, right? And so we may ourselves feel very closed off. I remember the first time I went into the grocery store with my mask on, and all I wanted to do was just bulldoze through and get out of there because I felt totally closed off from people. So how do we get beyond that? And you may even, this takes some practice. I'm doing better now, but we have so much communication that's beyond our mouth. And so, how do we have that twinkle in our eye? Can we convey kindness with our eyes, and with the rest of our body expression? These are really important ways to express ourselves. And so I put this up as kind of a brain break. These are my donkeys, and they're very good listeners. So really listening with our hearts when people need to tell us difficult things, and being all there. And be choiceful. We have a lot of things coming at us. You've chosen to come to this webinar today. I know you have other things that come to you, that there's a lot of people putting out a lot of good information right now, but really asking us, what do I need in this moment? There are lots of ways we can take care of ourselves and be resilient. And Dr. Wignall's presentation on Wednesday is going to go into a lot of these ways, mindfulness and resilience. Dr. Bartholomew's presentation talked about exercise and how that supports our mental health as well. The thing is that I mentioned that I really know mostly about in the realm of resilience is mindfulness and self-compassion. And so I want to talk a few moments about that. I'm actually a teacher of mindful self-compassion, the program through the Center for Mindful Self-Compassion. And I have some of these resources on the resource sheet as well. So if you're interested, you can look further. This program was developed by Drs. Kristen Neff and Chris Germer in 2010. And a good place to get started, if you're interested, is this workbook. It's a wonderful workbook that kind of does a self-guide through the program. So, a word about mindfulness. Mindfulness is really being aware of our present moment experience with some acceptance. That doesn't mean that we accept social inequity. It doesn't mean that we accept horrible things happening to us, but in that moment when bad things are happening, this is what is for this moment. And so in that moment, we accept it. And so, here I am, the human being, I'm worrying, is this picture going to turn out okay? Am I smiling? And my donkey, these donkeys are very mindful creatures. They really live in the moment, as many animals do. And the donkey's just thinking of, I'm just standing here with Barb, and this feels really good to me right now. What can help us anchor in the moment is our breath, sounds in the room, feeling our feet. These are great anchors that can bring us back to the present moment. And I'm sure Dr. Wignall's going to go much more into this. I'm going to focus a little more on compassion. Compassion is awareness of our distress and suffering in others, along with the desire to relieve it. So self-compassion is showing that same type of compassion for ourselves, including ourselves in our circle of our own good care, treating ourselves with the same care, kindness, compassion that we would a good friend. This is so hard for many of us. Me too, absolutely. This never occurred to me until 5-6 years ago when I was introduced to self-compassion and mindful self-compassion, and I started to learn about it and practice it. So important. There are 3 essential parts of self-compassion as defined by Kristen Neff, who's done really the yeoman's work of research on self-compassion. And first is mindfulness. So first, I have to recognize that, wow, this is a moment of struggle, rather than over-identifying with it and getting carried away with the story of what's not going right. I have to just be in this moment and say, yeah, this is really a hard time, or I'm really suffering right now, and be with those difficult emotions. The second part is common humanity. This is so huge right now because we're all in this pandemic even together, right? And common humanity is recognizing that we all struggle. This is what it means to be a human. Struggle and suffering is really part of our life. I'm not the only one. And this is, instead of becoming isolated, shutting down, not reaching out to others. So common humanity is so important. And then what really wraps the whole thing together is self-kindness, treating ourselves with the same care and kindness and love when we're struggling or suffering, actively comforting and supporting ourselves in times of struggle and protecting ourselves from harm. This is a very active process. And so we can do this rather than criticizing ourselves. Our internal voice sometimes is so harsh and demeaning towards ourselves, and we can learn to turn that around when we learn self-compassion. So self-compassion, and there's a lot of research on mindfulness as well, but I'm going to focus on self-compassion right now. Self-compassion as a trait that we have has been strongly identified with decreased rates of depression, anxiety, stress, and shame, and really strongly associated with increased happiness, life satisfaction, optimism, and good physical health. So lots of research to really support learning self-compassion. So some of the key question of mindful self-compassion is, what do I need right now? What do I need in this moment to care for myself, to be kind for myself? When we give ourselves compassion, we're giving it to ourselves, not necessarily to feel better, but because we feel bad. Now, feeling better is often a side effect of self-compassion. We may want to comfort our child who has the flu, even though we know that our comfort is not going to take that virus out of our child's body. But we want our child to just have our comfort and care because they're sick. It's the same sort of idea. So there's lots of resources. You have these on the resource page. And so, Dr. Korkor, is it okay if we spend 5 more minutes talking?
Yeah,
and I wanted to do a little practice.
Sure,
okay.
Sure. Yeah.
So right now I want to take you through a practice called the self-compassion break. And what I love about some of the mindfulness and self-compassion practices that I've been learning over the last 5 years is that I can do these on the spot. It's not like I have to leave what I'm doing and sit for 30 minutes and meditate, even though meditation is a wonderful way to increase our mindfulness and self-compassion. But I can also weave these practices into my daily life, just right on the spot. This is a tough moment. Yes, I can use this practice. And I'm going to teach you this little self-compassion break over some minutes, but you could do this in under 30 seconds if you can practice it. So, and the other thing is, I'm going to invite you to think of a situation that's giving you some mild to moderate difficulty right now. But I also know that sometimes we're in a spot where things are just too much right now. So please, if that's the case, the self-compassionate thing to do may be to just not do this practice, and you can just tune out for a few minutes. So just do as much as feels comfortable. So again, maybe taking your eyes off the screen, either by casting your gaze downward. You can close your eyes if that feels okay, whatever feels all right. And really thinking of a problem. It could be a problem at work, at home, perhaps in a relationship. It's some mild to moderate problem that's giving you some difficulty right now. And once you've thought of this problem, allow yourself to really recall some details of the situation, kind of feeling your way into it, what was said, what happened. Seeing if you can even feel a bit of this discomfort in your body somewhere as you bring this difficulty to mind. And now I'm going to take you through these three components of self-compassion. So now first is mindfulness. Saying to yourself, this is a moment of difficulty, or I am really struggling right now with this. You might even say, oh, this hurts. This hurts. This is painful. So that's the mindfulness. And now bringing into our realm the common humanity. Difficulty is a part of life. I'm not alone. Other people are struggling just like me with this situation. This is how it feels when people struggle in this way. That's the common humanity. And then third, self-kindness. If it feels all right, you might even want to put a hand on your arm or over your heart space, giving yourself the supportive touch and saying to yourself, may I be kind to myself. May I be kind to myself in this moment. May I give myself what I need. Or, you know, we can even be more forceful. We could say, hey, I've got your back. Barbara, we're going to get through this. I've got your back. You could speak to yourself. I do this self-talk all the time. It is so helpful. And if the words are hard to come by, even imagining, oh, if a friend of mine were struggling just in this way, what would I say to them to be comforting? What could I say to them to soothe? And then seeing if you can offer yourself those very same words. What would you say heart to heart? Oh. So with some practice, you could do this little break just in moments. It can help in the middle of an argument. I tend to, when I'm getting into a struggle with my husband, I bring this up and I think, okay, I'm going to step back here for a moment. I need a 2-minute self-compassion break, or I need a 20-second self-compassion break. And this really, really helps me. Okay, so let's go back to the slides and we're going to finish up just in the next moment here. So I saw this on the Greater Good magazine website, 6 daily questions to ask yourself in quarantine. I love these. And I'm going to end with this. These are ways we can be choiceful. We can decide what we want to do in our life. What am I grateful for today? Who am I checking in on or connecting with today? What expectations of normal am I letting go of today? How am I getting outside today? How am I moving my body today? What beauty am I either creating, cultivating, or inviting in today? So ways we can be choiceful. And after the webinar ends and our discussion ends, if you're concerned about yourself or someone you love who's thinking of suicide, someone you care about, please act and follow the ask, keep them safe, be there, help them connect, follow up, and do connect them with care. Also, think of someone in your life who's struggling right now and reach out to them. Reach out to them in the hours that follow the webinar. Let them know you're thinking of them, that you care about them, that you love them. And finally, whenever you can, treat yourself as you would a dear friend, because you matter too. This is my information, and I'm happy to talk about questions. You can tell I'm kind of an animal person. That's one of the ways I'm self-compassionate, is with my animals. So that is the end of my slides, and sorry to have gone over, Dr. Korkor.
No, no, absolutely. That was amazing. That was absolutely amazing. Thank you so much, Barbara. This was incredible. And
You are welcome.
the one thing that I take from it too in my own life is to slow down. Like I noticed that when I first introduced you and I first introduced the webinar, I was rushing because I was looking at the clock, and I know that in the process of having rushed, I have like probably not said the things I wanted to say, and I had my mind prepared to share, and because I was trying to, so slowing down is so important. I think taking a deep breath and just focus on the moment, and I think you be more kind to yourself, and you make better decision and share the information that you want to share in a much more comfortable and effective manner. Yeah.
Spot on, spot on.
Yeah. I do have a question for you. And I recently picked up the book, The Death of Despair, and recently came out. And one of the topic that you mentioned is that 40% of those who commit suicide, who die of suicide, I'm sorry, do not have diagnosis of mental illness. But how how well do we know that whether or not they did not have a diagnosis, but they actually have a mental health issues? So
Right.
how can you address that?
Well, we don't know. We don't know. And so there is so much stigma still surrounding, sadly, surrounding a diagnosis of a mental health disorder or a substance use disorder. I personally live with depression. I have since I was a teenager. And I've just recently started talking about it myself, just huge amounts of stigma. And so people don't seek care often, and this is also influenced by our culture, our families, how encouraged we are to seek care and get a diagnosis. So really, we don't know. We don't know. And so we have to get better at picking up signs of distress in other people. And so forget about the diagnosis, leave that to the professionals, but just look for distress, look for emotional pain, people who are just not themselves anymore. They're changing, they're withdrawing from you, they're not talking to you, their behaviors are changing, they're crying, they're using more substances, whatever that might be. We know people, and we can choose to recognize these signs of distress and take action. And so, it's really hard, but we just may not know.
Yeah. What do you think about the socioeconomic disparity in the depth of despair, where it appears that there is a tendency for people who are less fortunate to be more likely to engage in the behaviors that lead to the death of despair?
Yeah. Well, this is such a timely question right now, especially because COVID and some very just tragic deaths, recent deaths in Minneapolis of Mr. Floyd. It's just bringing bringing this to light right now. This incredible disparity, and people, um, you know, people die in different ways. I mean, I think one thing is that for people who live in poverty, the data is just not as accurate as for people who have means. And so, for instance, we know from our data that 70%, 60, 70%, depending on the year, of people who die from suicide in the United States are white males. Well, I'm not sure we have accurate data on people who are living in poverty, you know. And so the other factor is that there are these there's a lot of overlap in risk factors among the deaths, the types of deaths of despair. And so dying from a drug overdose, that could be suicide, or there could be some
Hmm.
parts of the intent there that are suicidal in nature. It's not always so clear cut. A person who's addicted to drugs undergoes, experiences great shame, and particularly during a period of relapse. And so that person who dies from the overdose, that it's deemed an overdose, but it could have been a suicide. So I'm not sure I'm totally answering your question, but it gets very muddy. And so we know that deaths of despair cut across all socioeconomic, any line you want to draw, culturally, economically, deaths of despair are there.
Do we have any statistics, Barb, on the current suicide rate in the United States? Do we have any indication that it is rising?
I've heard mixed things. So I've recently been on a call with Prevent Suicide Wisconsin, where different people representing different counties were calling in, and some were reporting lower rates of suicide, some definitely increased rates of suicide. I think it's going to take a longer period of time before we know, but certainly national experts are really expecting a rise in suicide rates. And I think as the impact of lots of losses, including economic loss. These impacts become totally felt. We're not going to know, but I suspect that the rates of suicide will rise. Yeah.
One other question we have about PTSD, and the current environment lead to a tremendous amount of stress, and so we anticipate this to be a major factor contributing to suicide, and if that is the case, what strategies that do you have that we can actually deal to try to address it?
Yeah. Well, trauma is certainly a big risk factor for deaths of despair, a history of trauma. And so people experience difficulty in different ways, and some people are going to have PTSD and some won't. One group that I'm very worried about, because I am a healthcare provider, are healthcare providers right now.
Yeah.
And some of these just horrible situations where they're needing to make decisions of who lives and who dies, who gets a ventilator and who doesn't get a ventilator. These cause real moral injury, which is a definite risk factor for suicide and other substance use and the whole thing. So what can we do to prevent it? Well, we can try to get some resilience and coping strategies to the people who are most at risk, and put some buffer there. So teaching things like mindfulness, ways to connect for people, getting them the help they need, connecting them to mental health professionals, especially people who are very skilled at treating trauma, can be of great help. But then it also comes down to the ability to access those services. And so having some of these coping strategies can help. I think just a factor of really, having some common humanity for groups of people undergoing trauma, if they can talk to one another about it and really be able to express these really painful, difficult emotions at the time as they're happening, rather than stuffing them down and just keep going forward, can be a huge help too.
Right. Right. And the early intervention obviously is much more helpful than.
Yeah.
Good. Barb, thank you so much for joining us. This was incredibly informative and very important. Notice that I'm slowing down. And we really value your effort and your continued effort on suicide prevention here in Wisconsin, and hopefully that this attempt that we have in delivering the information that you just shared can help us fend off the future or anticipated future increase in the rate of suicide in our nation. Thank you again so much, and thank you for your audience. Thanks you for staying with us. And like I said, this presentation will be available for you that you can listen to on our social media platform. And so we thank you so much for the participation. And I look forward to seeing you in our fourth and final webinar on Wednesday at 3 p.m. with Dr. Wignall. Thank you again, Dr. Moser, and thanks to all of you, and have a wonderful day. Thank you.
Thank you.